Well, hello and welcome back to the Texas A&M Dermatology Interest Group podcast. My name's Holly, and I'm a third year med student. And today I have with me Dr. Laura Russell. She's a PGY4 at St. Louis University School of Medicine's dermatology program. So I'll go ahead and let her introduce herself, but we're super excited to learn about you and your program today.
Well, hi, Holly. Thanks so much for having me. I'm really excited to talk about St. Louis University, or SLU as we call it. I'm originally from rural Northeast Missouri, Hannibal, Missouri, and I went to the 6-year BA MD program at University of Missouri, Kansas City. And then I also did my intern year there, which was a IM prelim year. And then after that, I did a 2-year research fellowship in clinical trials and dermatology at St. Louis University. And I've stayed on for residency, and I'll be doing a Derm Path fellowship after residency and staying at SLU for that.
That's super exciting. Well, congrats to you.
Thank you.
Yeah, I was looking through and you'll have a bunch of options for fellowships and really great
Mhm.
training. So thanks for telling us a little bit about you. And I kind of saw on your interest that you like rheumatology and things like that. What inspired your passion for that?
Yeah, I mean, I've had a lot of different experiences in my training, and we get like a wide breadth of training here at SLU. But I started doing some rheumatology quality improvement projects in med school, and then branched that into dermatology. And now I'm more interested in like the derm path side of dermatology, but definitely still like all the fun things in general dermatology.
Yes, for sure. Well, thanks
Yeah.
for telling us about you. So a little bit about SLU, as y'all call it. Can you just give us an overview of like the location and kind of your clinical sites, how many residents you have, just kind of the elevator pitch for the residency
Yeah. Yeah. So St. Louis University, it's a large academic hospital in kind of downtown to midtown St. Louis. So we have two main clinical sites in dermatology. One is a brand new, gorgeous clinic that's attached to the hospital. And then that's where we spend about half of our time. And then our other clinical site is in DePere, Missouri, which is about 20 minutes away. It's in more like suburban St. Louis. And we spend about the other half of our time there. We have 13 residents currently. Every year we have four regular positions and then an optional +1 position if there's a qualified person for our Kansas Access Tract, which is kind of a new program we're doing to promote access to dermatology in rural Kansas. So it's mostly for applicants who are from Kansas and have an interest in returning to Kansas after graduation. So for most of the time, we're either at our regular clinic or our kind of West County clinic, and then we also have a pediatric rotation. And the main pediatric hospital is just like less than a block away from our main hospital. And then one day a week, we also go out to like the suburban Peds clinic in South County, which is like 20 minutes away when you're on your Peds month. So, and then as far as our faculty goes, we have a wide range of experiences in our faculty. We've got 11 full time, two part time faculty. Out of those, we have one path trained dermatopathologist, four derm trained dermatopathologists, and those also do a mixture of gen derm and derm path. And then we have two faculty who do a mixture of general dermatology and cosmetics, three who do general dermatology, two Mo's, and one Pete's derm. So that's everybody.
Yeah, so y'all kind of have everything really and
Yeah,
truly a specific person or multiple for each of
yeah.
kind of the subspecialties. So as far as living in St. Louis goes, um, just drivability, I know you go to different clinical sites, and then the people that want to kind of go back home to Kansas have that option. But for you and your experience, would you say that most people require a car to live there, or is public transport more commonly used?
Yeah, I would definitely say it's very recommended to have a car just because we are sometimes traveling from clinical sites and the public transit in St. Louis isn't as widely accessible as some other cities. So all of our residents currently do have a car, and I think it would be pretty challenging without one.
Okay, that makes sense.
Yeah.
So then kind of shifting a little more into things for medical students that are looking at SLU as potential residency place. How does your program view students that have a PhD versus not? Is there any kind of specialty that they're looking for with research years or anything like that?
Mhm. Yeah, so we do have, like I alluded to, a clinical trial research fellowship that I did, but that's actually post intern year, 2 year clinical trial research fellowship. And so typically, applicants who have not matched and have done an intern year will apply like during their intern year, right before their intern year, and then do the 2 year fellowship and apply for residency again during the first year of that 2 year track. And most of those applicants do end up matching at SLU, but they are, encouraged to apply and go wherever they choose to. And then as far as like a research year during med school or getting a PhD, we do consider research as a positive experience in our holistic review process. However, like a majority of the residents have not done a pre-residency or during med school research fellowship or a PhD. So most people don't have those experiences, but it definitely doesn't hurt you to have done those.
Okay, that makes sense. Uh,
Mhm.
and then speaking also to application things, are away rotators at SLU guaranteed interviews? Can you speak to that at all?
Yeah, so way rotators are not guaranteed an interview. However, most do get an interview. We generally only don't interview someone if we don't feel like after the rotation they'd be a good fit for the program.
Okay, makes sense. And
Hmm.
then I don't know if you can speak to this as well or not, but has your institution accepted DO or IMG students? Do you have any advice for someone who might be in either of those categories?
Yeah, I think we definitely do accept DO residents. I know of a few in the past few years that we've accepted. We do not interview any IMG residents, though.
Okay. And then with all of the new stuff coming up with signals and geographic preferences, once again, if you don't know, completely fine. But do you know how SLU is approaching that with this next cycle?
Yeah, I mean, it could vary with the next cycle, but with the current cycle that we are just in, I can speak to what we did. And we only considered applicants who did signal. So even if you were like a SLU Med student, you had to signal for us to consider your application.
Okay, so even if you're a home
Yeah.
rotator, got it. Um, and then kind of going more into your training. So you mentioned you'll have a huge variety of people. You get training in all the subspecialties. What is the structure of your program? Do you get elective experience? Just kind of what's your 10,000 foot view?
Yeah. So you get pretty broad experience even early on. Um, because I think in dermatology, especially if you have any interest in derm path, you have to kind of get some broad experiences in the beginning to know in time for the fellowship application. So in our first year, we do 6 months of gen derm, 2 months of derm path, 2 months of peds, 1 month of Mo's, and then 1 month of float, where you kind of get a taste of like peds, Mo's, cosmetics, all those different kind of areas. You're usually doing your float towards the beginning of the year to kind of get used to things before you start doing the full month of that rotation. Your second year, you get 4.5 months of general dermatology, 2 months of Mo's, 2 months peds, 1.5 months of consults, a month of derm path, and a month of cosmetics. And then your last year, it's 5.5 months of gen derm, 2 months of consults, or sorry, 2 months of cosmetics, a month and a half of consults, 1 month of Mo's, 1 month of derm path, and 1 month of peds. So those are all of our like regular rotations. Now, if you are applying Mo's or you need to do aways, they definitely do support that as well. But it's more like an individual basis that you talk to the program about that. And since I haven't done that, I'm not sure how many weeks you're allowed to go or that type of thing. But I know they have allowed people to do aways, especially in support of like fellowship applications.
Okay, so it's a little bit customizable,
Hmm.
but mostly kind of the block rotations and then the flows to kind of get
Hmm.
your feet wet first.
Yeah.
Okay.
Yeah.
So since you've been in Missouri and you've gone to medical school and residency and all the things there, what is your favorite thing about, SLU as a program? Why did you choose it? What do you still really love about it?
Yeah, I'd say the people are probably the best thing about the program. I think we have really like kind and supportive like residents as well as faculty. So I think you can probably like learn dermatology anywhere you go. But one of the more important things to me when I was looking at programs is finding a place where I would really enjoy working with the people because that's what you're going to spend the majority of your time doing.
Absolutely. It makes a
Yeah,
difference. It's not what you do, but who you do it with usually.
yeah, for sure.
Um, and then what thing would you change about your program, or what area do you think there's room for improvement?
I think that one of the things that our program does well is like responding, um, very responsive to resident feedback and like any ways that we feel like the program could get better. We typically will let the program know, and they almost never like say no to that, which is really like remarkable. We do like a twice a year meeting where we can submit any like requests for changes to the program. And as long as you have like a good reason and how you think that this could work better, I can't remember any time where they've said no. So like an example is people wanted to get more injection experience when they're on their cosmetics months. And so we were able to start doing a half day each month with a facial plastic surgeon who does a lot of injections with filler. And so you got a lot more experience with that, doing that. And then another change people requested was to get to do a neurofibromatosis subspecialty clinic that was already going on, but derm just wasn't part of it. And so that became part of our PEDS month experience as well. So I think, anytime there's room for growth or changes, as long as, you know, there's reasoning behind it, it's pretty easy to get the faculty on board.
Yeah, that's fantastic. So you feel
Yeah.
really, really supported.
Yeah.
That seems to be pretty unique. It seems like y'all have a good ratio of faculty to students as well. So
Yeah.
that's awesome. And then how much autonomy would you say that you have as a resident kind of going through, your first year and beyond?
Yeah. So, I mean, I think the thing they tell you about residency is you should have like graduated autonomy, whereas you like further progress, you get more. And that's like, kind of cliche, but it's definitely like true.
Mhm.
And I've never felt in a position where I had to make decisions that I wasn't comfortable with, that I couldn't get support from. But at the same time, especially with like my resident continuity clinic patients, I totally feel like I'm the one in charge of like coming up with their plan and directing their care. And then the same thing with like procedural experience, especially as a first year, you're going to have the fellow, your most fellow, or you're attending there a lot more in the cases with you, like watching you, guiding you. And then as you progress, you're going to be on your own and they'll always be there if you need them, but you probably won't need them. So I think it just is kind of like a natural, like gradual process where you get, people get more comfortable as you get more comfortable, and then, it works out for everybody. So,
Yeah. Yeah, it sounds like the way that your training works, they set you up for success. So
yeah, for sure.
yeah. Um, and then how does the call and consult service work for y'all? I know you talked a little bit about the consult
Mhm.
service in the overview, but
Yeah, so the call is from 5 p.m. on a Friday, and then you'll cover the pager all through the weekend. And then the consult person picks it up again at 8 a.m. on Monday and kind of covers it 8 to 5, Monday to Friday, and then you'll cover it all those weeknights through Thursday night, and then hand it off to the next person. So you start taking call as a first year, kind of after Labor Day, around that time. Um, and whenever you're on call, like I said, you always have, the support that you need. So not only will you have a faculty that you're on call with, but you also have, as your backup call, a senior resident.
Mm.
So you'll have a third year paired with you. And anytime you're on call as a first or second year, you'll kind of pre-staff your consults with the third year first, like get their feedback and advice about it. And then you call your faculty and wake them up, and, you know, they'll be the final arbiter of what we're going to do for the plan. But so that's how our call works. You take it 1 week at a time, and depending on how many residents we have at a given time, it's usually anywhere from 5 to 7 weeks per year of call for the first and second years. And then only first years take the holiday calls,
Mm.
uh, which is really nice when you're a second year. And then as a third year, you don't take any primary call, but you are on backup call every like fourth or fifth week, depending on the number of residents. But for backup call, you generally don't go in. You just kind of give advice over the phone to your first or second year, so it's pretty easy. Occasionally, you might go in, like if one of the residents on call got sick and couldn't go in, or if they were having trouble doing a tricky biopsy or something like that, but not commonly. And then our consult service, like I said, is kind of 8 to 5, Monday to Friday. And that is either a second or a third year resident. And then you staff everything with whatever attendant is on service. And our associate program director, Dr. Berghemper, is also kind of our hospitalist dermatologist. So most of the time, she'll be your attending on consults from Monday to Thursday. She has her own like clinic on Fridays. So she doesn't do it then. But that makes it really, really nice for like continuity of care. And then also, since she's like a derm path attending, she has a lot more flexibility Monday through Thursday of when she can staff things. So it works out really well. You're not like waiting until the end of clinic to go like staff a bunch of consults and start doing biopsies. You can kind of talk to her as you go. And so then you can kind of wrap the day up, and all the other teams aren't calling you throughout the day asking for final recs. So it works out really well for everybody.
Yes, y'all found a rare, efficient
I
system.
know
Sounds like.
it works.
Well, thank you for explaining all
Yeah.
of that for everyone. So, kind of diving back down into research, I know we talked a little bit about PhD and research and things for
hmm
medical students, but once you're actually in the program at SLU, what are your research requirements? What does all of that look like for you guys?
Yeah. So I would say our program is really like clinically focused more so than research focused, but we do have some research endeavors that we get involved with. So the main projects you work on when you are a second year, you have to do an IRB approved research project that you start at the beginning of the year, and then you present it at our end of year research symposium, which is like this fun filled day. We have research symposium all morning, free lunch. We get an outside speaker, and they have the residents eat lunch with the speaker, and then you get the afternoon off, and then the evening we have our huge graduation parties. So it's a really fun day, and you get to kind of present your hard work from the year. So you do one research project. It can be any topic. We've got like so many faculty with so many different interests. It's not like hard to find a mentor. And then as a third year, you do a QI project. So you start that at the beginning of the year. You also present that at a research symposium. And then when you're a first year, you get paired up with both a second year and a third year. So you're kind of like an assistant on both of their projects, and you'll go up and help them present both of their projects, but you're not the main one doing the bulk of the work. You're just kind of getting your feet wet and learning kind of the ropes on how they do it. So those are our two big things in residency: is the research project second year and the QI project third year. We do a lot of little things here and there. So we'll have Some posters will present and things like that at like local conferences and at the AAD. Um, and then we also kind of try to get involved with medical students and help them make sure they have publications and write ups. And we'll do like a medical student symposium in the spring where they can present some of our cases too. So you have like a few other things you'll definitely do, but the only kind of big mandatory things are those two projects.
Okay. And then, so moving from research to community service, do y'all have any free clinics or other community service things that residents are commonly involved in?
Yes, so we do have a few big community service events. So one big one is our spring um, skin cancer screening that we do every year. So that one, if you're in town, you go to it, and it's on a Saturday, and we get a lot of our staff to volunteer as well. That's a big one we do every spring. We also try to do one big event either in the fall or spring where we volunteer either like making meals or going to a food pantry and kind of helping with that type of thing. And it's just good to get the whole group together. I think the nice thing that we do with that is it's not just like the residents, it's kind of the residents, faculty, and staff who are welcome. So we can kind of all work together outside of work towards a common topic or common goal. And then at our annual Christmas party, we also do a toiletries drive for the homeless shelter. And then there have been a few other events we've done, like we've done more skin cancer screenings at kind of a World Health Fair. I think it was a little over a year ago. And then in the past, we've also volunteered at a free clinic. There have been some institutional changes that have kind of limited our ability with that free clinic. I think they were moving from one location to another. So we haven't been able to get back involved with that free clinic yet. But if it, opens up and we're available, like if they're available to let us come back, I'm sure we'd love to.
Yeah, so it sounds like there's quite a few things that are kind of
Yeah.
dispersed throughout your time
Hmm.
there if you wanted. And yeah, and then for exam prep, so moving in from the work and clinic environment, how do lectures, things like that work for y'all throughout your time?
Yeah. So as chief resident, I help kind of organize some of that so I can speak to it. We have a really, really thorough kind of didactic series, is what we call it. So we get through a lot of material, and I think our residents are really prepared for their boards. So at the start of the year, we go through Andrews together. So we have like our weekly kind of textbook review sessions Monday, Tuesday, Wednesday mornings from 7:30 to 8:30 before clinic. And then on Thursdays, we have our kind of didactic half days in the morning. So twice a month, we have grand rounds where we go over different cases that are challenging or good learning cases. We also have our journal club once a month on Thursday mornings. We have our tumor board once a month on Thursday mornings. And then we have Derm Path Unknown slide sessions with our faculty 2 Thursdays a month as well. Um, and then let's see, other things we do. We have a lot of like few one-off things that we do. So we have a nail cadaver lab once a year
Hmm.
where we get everyone has a cadaver hand and forearm that we practice doing nail procedures on. And then if we have extra time, you can practice doing some excisions with the forearm. And one of our faculty leads that session and kind of demonstrates a lot of different tricky nail procedures. So it's great practice for us. We also will have 2 to 3 pig skin surgery sessions with our Mohs faculty where we can practice doing different flaps and suturing techniques on the pig skin, and that's on Thursday mornings as well. And then several cosmetic training sessions on Thursday mornings. So we have one like dedicated laser session on a Thursday morning, one injectable session where it's Botox and filler. Everyone practices on Thursday morning, and then usually one additional cosmetic sessions where we'll do micro needling and a few of the other lasers we don't get as much practice with. So those are our main things. And then Fridays are our derm path reviews. So with our fellow, they'll pull cases based on the chapter that we're doing for derm path.
Mhm.
And then you'll have the week to review those. And then on Fridays, we go through those with a fellow and kind of go around the table. Everybody will get a slide pulled, and you have to describe it and try to give your differential. So those are our main things. I guess the other books we get through besides Andrews, we get through a bunch of Kodachromes, the Spitz, Peds lectures, a lot of basic science, and we have a lot of faculty lectures sprinkled throughout the year too.
Yeah, so they kind of hit you from all those different angles.
Yep,
Gotcha.
absolutely.
And then do you have any protected administrative time for study before your board or for research, anything like that?
Yeah, so we don't have like blocks of time for research or for board studying, but it's just kind of sprinkled throughout your training. So we have what we call admin time, and generally you get about 26 half days of that per year. So like one every other week. And it can vary a little bit rotation to rotation. You may get more or less, but
Hmm.
um, it's a pretty good amount to kind of stay caught up with most things. And our residents definitely appreciate it.
I bet, yeah. Um, and then speaking of all the residents, do they have a big role in the interview and match process, or is that something more left to administration? What does that look like for SLU?
Yeah, I would say residents play a significant role in the interview and match process. So our chief residents, in addition to the faculty, will review the applications, and then once and then our program director and the faculty determine who to offer interviews to. And then once we have our interview candidates, for those interviews, we'll have like two evening sessions before their interview where we kind of just have a casual hangout with the residents and they can learn more about the program. And then a first and a third year resident will be paired up for each interview day. And they'll be kind of in a room on Zoom where they'll be part of your interviews. I think the nice thing is like the residents provide our feedback to the faculty and then we leave the rank meeting. So you're not going to, be biased against or for anyone that you might eventually work with which is nice. Because the first years would eventually be kind of co-residents with the current interviewer ease. So,
Yeah,
yep,
that makes sense.
yep.
Then for just the overall culture of your program, I know you chose SLU for the people. Would you say that SLU kind of attracts a certain type of personality, or do you think certain, like a big proportion of people have an interest in one area of dermatology, or is it more broad spread?
Yeah, that's a great question. I think we get like a really good mix of people, um, like people with interest in derm path, Mohs, gen derm, cosmetics, peds. Like we get the whole gamut. So I think we're not like really specific to one area. But I would say like the people here are generally really friendly. So like even though we're working hard, we're busy, like we almost always will make time to eat lunch as a group. So like all the residents, we just go down to the cafeteria, sit together and chat. And I think that just kind of speaks to like how much we really enjoy one another and hanging out with one another, even outside of work. Like, people are always going out to happy hours or different things like that. Like it's a pretty fun vibe. Like people get along really well, and there's not really much drama between the residents, I'd say. Like most people are happy to be here and they get along pretty well. So,
Yeah, so for anyone listening, no Grey's Anatomy experience here.
for sure.
That's awesome, though. And then do a lot of people have certain hobbies or fun things that they like to do outside of the hospital and training?
They definitely do. I have not gotten on board the running train, but that
Um,
has been the new thing. Like there are so many people here who like to run,
mm,
and they even signed up and did like a 5K together, and there's a lot of peer pressure, but
they
I withstood it. I could not do it,
didn't get
um, but
you.
yeah, no, I would definitely support them in their endeavors to run their hearts out. No, they had a great time though. In the running, there's a SLU Run Club, is what they're unofficially called now. We have so many residents who like to just like go on runs on a good Saturday morning and things like that. And they'll get brunch after coffee, and I can get behind the brunch side of it.
I was about to say I would hold the poster and then get the
Yeah,
bikes after.
exactly. Exactly.
All right. And then what's your favorite thing to do just in the city? Like if you're around the hospital and you're going out on a Friday night, what's your favorite thing to do?
Yeah, so now I have two little kids, so I don't go out many Friday nights, but my husband and I, we like to go out and explore a lot of the coffee shops in St. Louis. So that's kind of our favorite thing. We'll go try to do a different one most weekends, and I don't know how we haven't run out of coffee shops yet, but it seems like there must be.
Never
And
ending.
yeah, there's never ending, and they're all good. So I haven't really found one I didn't like yet. So yeah, there's a lot of really great places. There's a really good restaurant scene in St. Louis as well. Um, a lot of, good places for cocktails that a lot of residents will go to, especially in spring, summer. Rooftop bars are pretty popular. Um, yeah.
Okay. And then kind of speaking of kids, is there a policy that you know of for like maternity leave, paternity leave, maybe for some of the students that'll be, in that phase of life once they're in residency?
Yeah. So our program does grant 6 weeks of paid maternity or paternity leave. And I think that's a really important thing um, to know about the program. I mean, I think every program will provide that as an ACGME requirement nowadays, but just how supportive the program is going to be. So I found when I took maternity leave as a resident, the faculty were incredibly supportive. Like my program director and my chairman, like both took me aside, told me like if I needed any support or anything, never to hesitate to come to them. Like they could not have been more kind and welcoming of me, in that whole process, which really meant the world to me. So I think finding a place that's going to support you and what your needs are, and that just have genuinely like good and kind people is really important.
Yeah, I think that makes all the difference. Is if you want to enjoy that phase of life as well as enjoy residency, and so the attitudes surrounding it are important. And then kind of wrapping up on things, is there anything that you wish you would have known about SLU, positive or negative, that would have maybe influenced your decision when you were in the medical student seat?
I think not necessarily like about SLU, because I don't know. I like did a research fellowship there when I like applied, so I felt like I already really knew the program. But I think like if I could go back, one thing I want to know is that you might want to keep like a really open mind as to what you might end up going into in dermatology. Because when I was applying, I thought for sure I would do like general dermatology and that would be it. And now I'm about to do a derm path fellowship. So just keep an open mind, because like you might be surprised by what you enjoy. So don't kind of get siloed into like, I just want to do Mohs or I just want this. Like, especially if you can get, a different electives during your first year, and get exposed to them, you might find something that really surprises you that you have a passion for. So I would keep an eye out for that.
Yeah, so don't try to predetermine your
Yeah.
life before you get there.
Hmm.
And then I looked at y'all's website and it's beautiful and it has a lot of the stuff
Well,
that
thank
we talked
you.
about. But are there any other avenues or events or things that students should use to find out more information about your program?
Yeah, so we thank you so much for the shout out to our website.
It really
Um,
is for people. It's beautiful
and
and so organized.
oh, well, great. Oh, I appreciate that. So we also have an Instagram. Our resident Jamie is keeping hard at work of updating it with all of our fun social events that we do as a group. So that's SLU Dermatology on Instagram. And then every August, we do an open house with all the applicants. And then our program director and assistant program director are both on there as well. So if you follow us on Instagram, you'll see when we post about it, about the open house. So that's a good way to learn more. And you can also ask questions during the open house if you have any questions. If you're going to want to rotate with us, I think you can apply on VSAS. And then we have the world's best program coordinator, Joey Weissman. She is a gem. And so she's really, really great at communicating with the way rotators about their rotation and different questions that they might have. And then if you are applying for SLU and we interview you, just know that we do not communicate after the interview at all. So we're not like trying to ghost you, but if you send us thank yous, we follow the I think it's the APD that says like, not to communicate with applicants. So that's why we will not be responding. So
Makes sense.
yeah.
I did have a follow-up question on that. So if someone is couples matching, I know it's typical protocol. If one person gets, a rotation somewhere to email and say, "Hey, I'm interviewing here." That's what we've kind of been told about couples match from the people that we've learned about it from. So for communication in that instance, would that be appropriate, or is it still just
Oh yeah, like we're happy to communicate with anyone like pre-interview, but it's just like right after the interview, like we pretty much make the rank list immediately. And we have been, that's what the official guidelines recommend, like not to communicate after the interview with applicants to give them kind of mixed signals or anything like that.
Mm,
So that's just the only time where we won't. But don't feel like you can't email us any other thing, You can, even if you want to email us after the interview, we just won't be able to respond to it.
gotcha. All the policies and things, and
Yeah.
that helps decrease all the stuff you'll have to shuffle through
Yeah.
after. Well, thank you so much for telling us about SLU and sharing a little bit about yourself. Is there anything else that we didn't talk about that you feel would be really valuable for medical students to know that are interested in your program?
Yeah, I think, I know the derm match is extremely hard and extremely stressful. So just kind of work hard, keep a positive attitude, and keep an open mind. And even if it doesn't work out the way you had planned, if it's something you really want, just keep working at it. Um, and, sometimes doors will open when you least suspect it. So,
Mm, that's sage advice. You never know what a day will hold. But well, thank you
yeah.
so much for talking with us and for
You're
sharing
welcome.
tips.
Thanks for having me.
Absolutely. We super appreciate it.
All
And
right.
thank you for everyone who's watching. I hope you guys enjoyed learning about SLU.
All right. Take care. Bye bye.
You as well. Bye. Thank you.